today we are adding a new chapter to this hospital by under CSR. Paradeep Phosphate has donated all the equipment that is necessary to carry cataract operations here. As you know, eyesight is something very important, and people had to travel all the way to Margam, and some of them used to prefer to go to Panjim. Now that will not be necessary. Right here, cataract operations will be done, and all other related services that are required or the support that is required, the patient is going to get right here in Sub-District Hospital. As you have seen during COVID period, it was a very trying period for us. But people kept complimenting the doctors and the nurses because the services that were available here was comparable to the best during very trying times. And at that point of time, I again want to thank all the corporates for coming forward on my word and very handsomely giving us or rewarding us with equipment that was necessary to shore up the hospital itself. In that respect, as you know, we had problems initially of oxygen supply. That was sorted out. Doctors needed certain facilities. There were no computers. There were no basic equipment. All that was given by different people at different point of time, including a modern ambulance which had all the equipment. It was not just a plain ambulance, which had trauma facilities and everything related. So that way, if you have seen, things have substantially improved in Sub-District Hospital Chikali. We want to take it even several notches above. I have spoken to the health minister that he has to visit this hospital. I want to specially get him so that we will get more doctors if necessary. We will get more specialists. We will get more nurses, and automatically other supporting staff will follow. That way, the facility is available for the whole of Murmungaon. We have the airport, we have the railway, we have other air connectivity in a big way. So naturally, there are a lot of patients that automatically tend to come here, whether through an accident or normal sicknesses. So we have to improve the facilities, and that is what we are going to do.
So today is a perfect example where Paradeep Phosphate Limited, Goa unit, has come forward. They themselves has come forward and requested expressed their wish to do something for the hospital. And that's one thing it was always in our minds to start cataract surgery. As Sir said, our people have to travel all the way to Margam. So around 50-60 आमचे पेशंट थंय मडगांव वता cataract surgery. So why not do it here? Because we have a OT setup. So and they have done a wonderful job in no time. I mean, hardly any time when the instruments are here. Now it's up to us to buck up and start the OT as soon as possible.
Under the CSR activity, we always felt to support health and education. And as a part of health, when we approached this hospital, we were always connected with this hospital, especially during COVID. A lot of our employees, our contract workers used to come to this hospital, and the hospital per se has supported us in a very large way. So as a giving back to the society, when we approach this hospital, we realize that they are in need of the cataract operations tools. The entire cataract operations tools are part of this at the cost of 22 lakhs. We have donated to this hospital so that it goes to the people.